Yeah, we saw some interesting differences between caloric restriction and intermittent fasting. And the one that really struck me is that mice who are feeding ad lib, so all you can eat, which mice self-regulate, they do a good job. They have healthy diets.
Hmm.
They tend to grow and they gain lean mass almost throughout their entire lifespan.
Hmm.
And the intermittent fasting mice, despite their weekly deprivation, if you would, gain lean mass. They lose some fat mass, and so they're leaner, but they don't lose that muscle. They don't get smaller.
Hmm.
Caloric restriction mice lose everything. They lose lean mass. They get smaller. That's one thing we noticed. Another thing we noticed, and that is, I need to talk about red blood cells for a minute.
Hmm.
You want to give me permission to do that?
Yeah, absolutely. Yeah, yeah, yeah.
Red blood cells are the most common red cell in your body. You've got trillions of these things,
Hmm.
okay? And they not only do they deliver oxygen to your whole system, but they do all kinds of biochemical things while they're flowing around through your circulation. And a red blood cell lives about 120 days in circulation. And the way that happens is as red blood cells age, they tend to get bigger. And your spleen is constantly monitoring the red cells and it'll identify the big ones and filter them out. So it's keeping the red cell population healthy.
Hmm.
So one of the measures that we take on these mice is we look at their red cells. We know how big they are, we know how much hemoglobin they have in them, and we know their distribution. We know how big they are. And what happens in especially the 2 day intermittent fasting, but also in the 40% CR mice, is that distribution gets wider. And that tells us that the spleen is not doing its job efficiently. It's not
Mm.
clearing out the red blood cells the way it should be. And this measure, RDW, it'll be on your on your report from your annual health because it's typical clinical measurement from a complete blood count test,
Hmm. Hmm.
is already known to predict lifespan in humans. And here we're looking at interventions that extend lifespan, but they also increase RDW, which reduces lifespan. And I, and this is a pattern and a theme that comes up over and over again. And remember, diet arrow pointing to lifespan with a plus sign. Now, that arrow has hidden in it all kinds of things, and that's why we measured all kinds of things. We want to pull that arrow apart and find out, well, what are the steps along the way from diet to lifespan? And one of those things is RDW. So you picture an arrow from diet to RDW with a plus sign, but then RDW to lifespan with a minus sign.
Hmm.
It's contradictory.
Right.
And we saw this again and again.